It is a special event that brought together Mater Hospital Cardiac Program trustees, stakeholders, benefactors and beneficiaries to officially flag off the Mater Heart Run campaign 2022.
The Mater Heart Run 2022 has been officially launched.
Today I'm excited because we have launched the Mater Heart Run 2022. And for us, this is a great win because in the 2020 and 2021, we did not have the Mater Heart Run. And what it means is that if we don't have the Mater Heart Run, we do not have a platform where we invite well-wishers, our partners and our supporters to come together to raise funds, which is put into the Mater Heart Fund.
We are grateful for the continued partnership and support that you have accorded us and ensuring that the needy children with cardiac diseases get new lease of life.
The Heart Run, a Mater Hospital trademark that has been running for the past 25 years, is an annual campaign that raises funds to support needy children with cardiac defects and are otherwise unable to fund the costly medical procedures.
That is what Mater Heart Run is about. It's about touching the lives of children who have no way of ever coming back and saying thank you to us because of what we have done. But for us who have the ability to touch their lives, it gives us that one chance to do that.
Remember, cardiac surgery is very expensive because of the expensive consumables that are used, the specialized doctors that need to take care of the patients and even perform the procedures, even taking care of them in ICU.
Program trustees took the opportunity to outline this year's target and budgets ahead of the actual campaign in June 2022 as they called for support from people of goodwill.
This year, our target is 200 children from both open heart surgery and cardiac catheterization. These procedures will be achieved through your generous support. Already we have about 250 children on the waiting list, and this list continues to grow every day.
We can give our children a new lease of life by repairing the broken hearts. Broken in as those that have holes in their hearts, those that have valves that are damaged and need replacement, those that have vessels that are constricted and they are not taking blood where it's supposed to be taken.
The cardiac program targets children from economically disadvantaged families in line with the values of Sisters of Mercy, which seek to uplift the dignity of the underprivileged in society in the most compassionate way.
The interventions are focused on those who are not able to have financial capacity to deal with their ailments, and that calls on the charism of the Sisters of Mercy. That's a focus.
The campaign has so far benefited over 4,000 cardiac surgery and catheterization beneficiaries through generous donations from local and international donors, coupled with a team of dedicated medical specialists.
A time came when all our resources were depleted, yet we still had a number of cases. It is a leadership that believed that there will be a better tomorrow, and we have not turned a single critical case back.
Andres alikuwa ameturn, the tongue ilikuwa imeturn into purple, makucha zina grow zikiingia ndani. He was pale, angetembea from here to there, ana squat, anainama hawezi fanya anything. He started fainting. Andres alikuwa anaweza like 1 hour, the next hour amefaint. Tulianza kutembea na oxygen, but venye tulifika Mater, for real tulikuwa tume lose hope. Friends walituacha, but Mater ilitupokea, ikatukumbatia, wakatusaidia na surgery. Sahi Andres anaendelea vizuri.
My name is Andres Matano. I am 7 years old. Once I had a heart surgery and I had a problem. And my parents took me to Mata Hospital. They treated me well and I'm doing well. Thank you.
22-year-old Milka Atieno, one of the Mata Heart-Run beneficiaries, had been on and off hospital, grappling with incessant health symptoms. Little did she know that she had multiple cardiac perforations.
I had several holes. Wakaniambia nitahave kwanza clinic. Ili ilifika 2019 March, nika lose hope. Nikasema no clinics anymore. So vile nili lose hope, kapata Mata wakanishikilia. Relatives walienda silent. My mom na my dad, my siblings ndio walini support.
Many other children who had lost hope of living due to heart diseases have found recourse in the Mata Heart-Run program.
My name is Misericordiae and I'm 11 years old. I'm going grade 6 and I thank Mata Hospital for making me feel better. And now I am a grown girl and I thank Mata Hospital so much. I thank you to Mata Hospital. I'm grateful for you. And I thank God for everything.
Hii foundation yao imetuhelp sana. Back then sikuwa najua kuna kwanga na foundation kama hii inaweza saidia weak heart, hopeless heart. Ningependa kufanya what my friends were doing, what my classmates were doing, but ilikuwanga challenging. Ilini affect sana kwa sababu when people are moving to another class, me I'm still in the hospital. Most of the times nilikuwa na pass out, more faints, more weakness. But vile nilikuwa treated, nikahave kuendelea na studies zangu.
These are beneficiaries as way back as 2018, 2019 and 2021. These are children who were not able to go to school regularly. They were not able to play with their colleagues, but because of the program, now some of them have gone back to school and they are able to relate well.
Kurudisha shukrani kwa vile Mata walisimama na sisi wakati tulikuwa tumekosa njia kabisa, na wakati tulienda walitusaidia kabisa. Mungu awabariki sana.
The Mata Heart-Run campaign is on in full swing, and what stands out the most is the need to improve cardiac disease treatment and management, not just in children but also in adults.
We still hope that we should be able with time and with continuous practice, and we'll be doing most of the cases, that we will be able to come down and do most of the cases. And I'm trusting that that cardiac center, Mata, will be the first one to get it to profit.
Over the years, the program has opened its doors to other clients through self-sponsorship and insurance covers, and among these, the NHIF, which have played a very key role.
The day will also be marked in 11 different counties across the country.
If you're in Nairobi, the run will be Nairobi. If you're in Nyeri, there will be a run. If you're in Nakuru, there will be a run. If you're in Mombasa, there will be a run. If you're in Kericho, there will be a run. If you're in Bomet, there will be a run. If you're in Kisumu, there will be a run, and there will be a run in Kakamega and Eldoret. Kindly come and let us all support these children.
I'm aware of the post-COVID-19 economic challenges, but I hope your big hearts will go beyond these challenges to touch the little hearts of our children, who are going to be our future leaders.
For individuals, you get onto the Mata website. We have the Mata Heart-Run paybill number, it's there. As a corporate, you can also talk to us. And when the t-shirts come out, buy t-shirts. Even if you're not able to give money, you can buy t-shirts for your groups, at your place of work, do it as a CSR, and join us for the run.
When you touch a child's heart, you touch the society. That's the core. That's where we began.
Touch our child's hearts.
It is an annual iconic cardiac program popularly known as the Matter Heart Run, which had stalled for the past 2 years owing to the adverse effects posed by the COVID-19 pandemic. And as all well-wishers, stakeholders and sponsors gather here today to launch this program, the Matter Heart Run 2022, there is a call to every person who is able to step up and touch a child's heart in a special way as we await for the actual Matter Heart Run on the 11th of June. Asasha Elizabeth, Capuchin TV at the KICC, Nairobi. A very warm good morning time for this health discourse today being Friday morning. As usual, we are true to our word and true to our mission of enlightening you about different medical conditions, how best you can get diagnosed, how you can live a healthy living. Now today we are set to discuss a medical condition, one that the World Health Organization estimates that more than 300 million people worldwide suffer from it, and it is one of the major causes of severe suffering in the world and contributes greatly to the world or global burden of disease. And with me studio is a beautiful medical officer from Mater Hospital. Allow me to introduce her to you before we make progress. Welcome.
Thank you.
Kindly tell us your name, your second name. I just don't want to, maybe I'll just hear it from you first, lest I bite my tongue.
My name is Dr. Pascaline Chishatse. Yes.
Isichase.
Yes.
Isichase Pascaline. All right, so what do you do at Mater Hospital?
I'm a medical officer at Mater Misericordiae Hospital. Yes.
Where you based? Do you rotate in all the satellite clinics, or you're based in a specific one, or at the main hospital?
I'm based at the main hospital.
Main hospital.
Yes.
Welcome, and thank you very much for making time for this discussion. So the condition is depression, and we have been witnessing cases, acts of severe pain, severe suffering, violence, and we really cannot attribute fully this to depression, but we can get to hear it from the experts themselves. But first things first, let's get to know first, how healthy is stress? Because, you know, stress and depression, the difference?
Depression, by definition, is when someone has a feeling of sadness, which affects their daily routine. People are not able to function anymore when they have depression. But when you have stress and it is manageable, you are able to function. You are able to wake up and go to work. But now for people with depression, they are not able to do that because they affect that aspect of their life.
All right, they affect their normal functioning or their performance, daily performance. All right, dear viewer, you can be part of this conversation by sending your questions, your queries, your comments or contribution towards this on 0717424866. Do not hesitate to drop your feedback or your reactions on our social media platforms. That's on Facebook and YouTube. My name is Sasha Elizabeth, and off we take. Now, okay, you mentioned about depression, the feeling of sadness that really alters one's normal operations. How different is it from stress?
When we talk about depression, we talk about a mental illness, in whereby someone has a feeling of sadness, or they have loss of interest in activity that they usually used to find very interesting to them. And then it is most of the day they feel like that until it lasts more than 2 weeks. While for stress, everyone gets stressed, but now you won't be. It won't interfere with your normal activity. It won't interfere with your work. But now for people with depressed, who are depressed, will find that they spend the time maybe in the house. They can't be able to go to work because of that feeling of sadness, and they have lost interest in different aspects of life.
All right, now, I was having a conversation with a medic, and who is he deals with mental issues, mental conditions. So she was telling me that stress rather can be healthy. How healthy can stress be? Because anything that really is uncomfortable cannot really be healthy. Probably you can help us understand that.
Okay, when you have stress, sometimes stress is nice because you want to deal with, let's say you have stress at work that you are supposed to finish something. So when you are stressed, you will be able to finish. It will push you. You won't lack interest. So that's also a healthy way, because stress will make you do things. Yes.
So it's like it motivates you.
It motivates you, which is different from depression, where now you will lose interest. You won't be able to do anything.
Is depression an escalated level of stress?
Yes, if you are not able to cope with stress, sometimes it may lead to depression over a long time, because some people, you may be having stress, and also you have like genetic, like in your genetic, there's some people who have gotten depression, and also there are other environmental factors which can lead you to be depressed. So if you have now some level of stress that you are not able to cope with, it may lead you to depression. Yes.
Okay, thank you very much, Dr. Pascaline. Now, according to the records on the World Health Organization, so many people live with depression in our current world. What could we attribute this to?
Yes, first there is growing in social media. So there is pressure from social media. Everyone wants to be like a certain person they see on those social media. And also most people now are rather living isolated. You would find people are staying alone, so they don't have someone to talk to or to help them in relieving their stress. So over a period of time, these people may be depressed. And also in terms of someone knowing that you are depressed, no one is going to know, because most people are not caring for each other. Yes.
So trying to live another person's life, or having your ambitions up there?
Yes, when you have like, you're trying to live a kind of life that people on social media are living, but you are not able to sustain that kind of life. So it may make you depressed. it's one of the risk factors. Yes.
So it's good to set goals, but make sure you set realistic and achievable goals, and do not try to imitate another person's life, because you know social media can really lie. We have witnessed cases of people who look really happy, like they've really made it in life, but the next minute what you hear is quite appalling. All right, so now we've seen even children as young as 15, teenagers, committing suicide, hurting themselves, hurting each other. What's your take about this?
So depression can affect anyone of any gender, any age. It doesn't have limitation to a certain population. So even teenagers get also depressed, especially if they don't have anyone to talk to, they also may be depressed, yes.
So what are the telltale signs of depression? Because we have stress and you have depression. What are these signs that can tell you this is depression? How do you draw a line between the two?
Okay, so in depression, someone may be having one of these two, feeling depressed. They have a depressed mood, or they feel sad all the time, or they have lack of interest in activity that they once found very interesting. And also there is other symptom, like someone sleeping, the sleeping pattern increase or it is decreased. Also someone starts having a lot of appetite, or the appetite is decreased, leading to either weight gain or weight loss. People start losing concentration. People starting having thought of suicide, or even some may start committing suicide. There is also other symptom of depression. When someone also has agitation, you will find those people sometimes agitated. So those are some of the symptoms that someone who is depressed may have. But the first two main symptoms are feeling sad all the time, and also lack of interest in activity that someone once found interesting. Yes.
Thank you very much for that in-depth explanation. Now, are there different types of depression, and do they vary in severity? Are the symptoms different?
Okay, so now what we are explaining today mostly it's a major depressive disorder. So there is other type like postpartum depression, where people who have just delivered may present with those symptoms that I have just said, but now in 4 weeks after delivery. There is also atypical depression, where someone have that feeling of sadness, also they have increased in weight. They get fear of rejection, which is mild. There is also a persistent depression, in which someone suffers all those symptoms in a period of 2 years. Also, you can have depression which is induced by drugs. You can have depression which is induced by medication, and there is also other unspecified type of depression.
What kind of drugs are they? The prescribed medicines, or just drug and substance consumption?
Yes, there is now drug abuse, and also there is some drugs which have those kind of side effects. Yes.
Okay, so how can one get help when you feel that you have really those signs that are really a red flag, and you think that you could be depressed? How do I find help?
So the first thing, the best way is to go to the hospital, a near health facility, and talk to the doctor or any healthcare provider that will be able to guide you. Also, there is, if you are not able, I found some people, they are not able even to explain themselves when they come to the hospital. So another best way is you can write those symptoms, you can write how you feel, because those people sometimes when they go in public place, they are not even able to explain themselves, because feeling worthlessness and also feeling helpless, it's one of also the symptoms. So those people may not able to communicate as how they wish they would. So you write those symptoms and also go to the nearest health facility and ask for help. There is medical officers, there is also psychiatrists, and also there is psychotherapists who will be able to help you in those healthcare facilities. Yes.
Yeah, you mentioned that most of the people suffering from not just depression but even other mental health conditions, they always feel reluctant to seek out help because of the stigma associated with it.
Yes.
So now, how best can this person, is there a way they can receive treatment in privacy, like on anonymity, or is it okay for them to share? I know you've always encouraged sharing with the close friends or relatives who can help them find help.
Yes, I think now when you come to the hospital, no one is going to know about your condition, and you will be referred appropriately. You will also even be involved in group of people who you share similar disease, and you will be able to feel like you are not alone in this. Yes, so you can always seek the medical, you can go to the nearest medical facility and no one is going to know that you are battling depression. Yes.
With a lot of sensitization happening in digital spaces, in communities about mental health, we still see, witness rising cases of suicide, self-harm, and homicide, which can be linked to mental health or depression. What is it that hasn't been done? What is it that you're not doing properly, or what is it that you would suggest to be rectified or done in a different way?
Okay, one thing is to create awareness. So we continue to create awareness as we are doing right now, so that people are at least aware of the symptom. Those people who are not able to talk to anyone, they're able to come to the health facility. Another thing is to not stigmatize depression. People get depression, and also when with the correct diagnosis and the correct treatment, people are able to overcome that. So people shouldn't be ashamed that they are depressed, because they can fight that. Yes, so with avoiding of stigmatization and also creating awareness, I'm sure we will be able to battle depression.
What is the best way of creating awareness? Is it the physical contact or visits to different places? Or how can we make sure that this sensitization is actually effective, or it gets to the right people?
Yes, so if you know anything about depression, if you are watching this show, you can be able to also tell your friends. You can tell them, I have heard about depression, I know these are the symptoms. So if you tell someone, once you tell them, they are able now to know that, because it is direct. Also to continue posting on social media, so that at least people can know about depression. Yeah, that will help. Also going to talk to the teenagers, especially in high schools. Yes.
You mentioned that children are not immune to this condition.
Yes.
And so now, in terms of, the children cannot, it's not easy for them to tell that something is really eating them up, or just to pinpoint or link these signs and symptoms to depression. How can parents or guardians make sure that or help these children? What kind of signs should they observe, and at what point should they take this child for medication?
So the first thing is to be able to talk to your children frequently, so that at least you are able to know what's going on in their life. So for little children, they may be irritable, they start crying a lot, you can't find what is causing them to cry. For teenagers, they will present as how an adult will present. So it's you to basically watch and see. You will see that they have maybe not come out of their room for a while. They are not talking. They have lost hope for a period, like it's almost daily, and it is for a period which is more than 2 weeks. When it is a period which is more than 2 weeks, then you should be concerned, and also you can now come with that child or that teenager to the hospital. Yes.
How do you convince this child now to go to the hospital? Because like many other patients, they wouldn't feel that okay to share what is in their mind, and they wouldn't want to feel like they are actually sick. So as a guardian or a parent, how do you go about that?
So first is to talk to them You explain to them that this is depression. It is a treatable condition. That's what you think as a parent. Maybe that your child is suffering from depression. You explain to them. So once you explain to them, they will be also they will be willing to come to you to the hospital. Yes, and also you can encourage them to write things down and then come to the hospital. You tell them that depression is just treatable, and it's not something that they should feel afraid to talk about. Yes.
Thank you very much. Now, once they get to the hospital, how do you diagnose depression?
Depression is usually diagnosed by a medical personnel. There is a criteria for that diagnosis of depression. So this person, they have suffered either one of those two symptoms that I have been saying. Those include feeling depressed. Your mood is, you have a depressed mood, or you have lack of interest. One of those two should be there. And also, so in total, there should be 5 out of those 9 symptoms that I've said, including they have lost appetite, or they have weight gain or weight loss. They are sleeping too much or too little. They have lack of concentration. They have suicidal ideation. They are feeling agitated all the time. They are always hopeless, or they feel worthlessness. Yeah. So when someone has 5 of those out of 9, in which you can't determine what else can describe those symptoms, then they may be diagnosed to have depression. And also you have to rule out for them if they have any substance of abuse, or if there is any other mental disorder which can explain those symptoms better.
Yes. Are there any kind of tests that are performed on the patient, or you just use the signs and symptoms to infer?
So you use those signs and symptoms, and also you have to rule out any medical condition. So there is some tests which will be done. Things like thyroid diseases, they may cause things which are similar to, which may present as depression. So they usually take a blood test to rule out all of those. And then after they have ruled all of those, then they can determine this patient has major depressive disorder. Yes.
So there are some diseases that can mimic these signs and symptoms of depression.
Yes.
All right, dear viewer, that's it. I'm told it's time to take a break, our first session, and we'll be back with our second session on depression, which is a silent killer affecting majority, so many people, young and old. So do stay with us. We'll be right back with more.
Capuchin TV, your Catholic identity. Welcome to Misericordiae Hospital, Nairobi CBD Medical Center.
Development House Medical Center was opened about slightly above 10 years ago, and since then we've been providing ambulatory care to clients who come to us. The clinic is located between Tomboya Street and Moi Avenue, right opposite the Pioneer Building.
We guarantee our patients quality standards and variety of medical services.
At Development House Town Clinic, we have the following services. We offer doctor's consultation. We also offer physician services on Mondays and Fridays, obstetric and gynecologist services on Wednesdays and Saturdays, nutritional services on Fridays. We also have a well-equipped pharmacy, a well-equipped laboratory. We have physiotherapists, and we also have just begun our wellness services as a way of encouraging preventive medicine.
We provide specialized services, that is gynecology, and antenatal clinics. We provide services to the diabetics and the hypertensive patients. We give nursing services. We will do your dressing, we give you injections, we also provide some counseling services. We have specialized counselors that would give you natural family planning counseling and guidance, and you'd also get the general counseling. We also provide adult immunization, and basically for adults who want to travel, we are able to give you the vaccines that you need.
We uphold the dignity and privacy of our patients as we strive to meet your healthcare needs holistically and in a more compassionate way.
The service that you'd receive at our medical center is a value with a touch of Christ. We do not just want you to be taken care of physically, but you also think about your spiritual care and spiritual growth.
Visit us every Monday to Friday from 8 a.m. to 6:30 p.m. and every Saturday from 9 a.m. to 3:30 p.m. and get value for your money.
We ensure that you're seen within the shortest time possible, however, providing quality care.
I welcome you all to Mater Hospital CBD. We assure you of timely, efficient, and satisfactory services.
Capuchin TV, your Catholic identity.
just a recap to the view about this kind of treatments that are available for depression.
Yes, so we have, as I said, we have psychotherapy, which is called the talk therapy. So that is the therapy which involves you and the psychotherapist to talk and then check on the coping mechanism, check the thing which aggravate your condition, which are most likely to get you into depression. We also have group therapy in which we will you talk to people with similar issue, so you are able to know this one had depression, let's say, and then this is how they dealt with it, so you are able at least to feel that you are not alone. And also we have family and friend therapy, in which the family and friend, they come to therapy in order for them to know how best to support someone with depression. Yeah, so the therapy where you study about the coping mechanism and how to use like positive coping mechanism to solve your current situation is called cognitive behavioral therapy. So also something that I forgot to mention earlier is there's also another non-medical therapy which is called ECT, that is electroconvulsive therapy. So
is a patient subjected to some kind of electro?
Yes. So someone, those people are taken under anesthesia, definitely with the consent, and there is electrical stimulation to their brain, which now help them to get out of depression. But this kind of therapy is usually used for people with severe depression, which is not responding to those medication. It's usually like a last line treatment. Yeah, and that involves like talking to the relatives, talking to that patient for them to understand.
So that's the last resort.
Yes.
How risky is the procedure? First, how does it work out?
So it usually kind of causes seizure in the brain. So the mode of action is not clear, even though it has been there from 1940s, but it's not clear exactly how it helps in relieving the depression symptom. But usually, because they are electric brain stimulation, it will cause some kind of seizure. So usually after that seizure, around 50% of those people who are suffering from depression, those people who are not responding to medication, you have definitely tried everything, increasing the dosage of medication, and it is not working. No, that is the last resort for them, is to undergo the ECT treatment.
And how risky is it?
Yeah, because now it causes seizures, and now you can imagine, because for some people they may continue to have those seizures afterward. That's why you need consent, good explanation by your healthcare providers about the procedure, and also what to expect after and the complication. Yes.
And what is this most common medication that is always prescribed for people with depression?
We have fluoxetine, which is an SSRI. That is selective serotonin reuptake inhibitors. That is one of the most common prescribed. Yes.
Thank you very much.
Yes. Yeah, for those medication, now depending, as I said, now depending also on some side effects, you need to talk to the healthcare provider before taking it, because we have to take you as a person and see what else do you have, your age, your gender, and also now be able to prescribe medication which will be better for you. Yes.
Thank you, Dr. Sishate. Now, there's someone asking, this is Rita Siovata from Makueni. She just inboxed me and she's asking, can depression cause severe headache? And can I get treatment from she's asking about over-the-counter treatment from chemists.
Yes, so another thing maybe I forgot to mention about the symptoms, some people actually may come in with pain, aches of known origin. So you will find someone who has been treating their headache for many years, or someone who has been having abdominal pain, someone who has been having, let's say, limb pain, and you have ruled out any other cause, any other possible cause to cause this condition. That may be one of the symptom for depression. But first, you have to rule out every other thing which can cause that headache. So it's not a best advice to go and get an over-counter medication. One, because maybe that headache is being caused by other things. So you need to go and seek healthcare profession in order to be able to reach to the conclusion that this is depression. Because if you just have headache only, that might not be depression. As I said, you have to have at least one of those two. So having a depressed mood or having lack of interest in things that you usually used to find interesting. So if you have one of those two, and then you have other four of those other symptoms that we talked about, having reduced appetite or increased appetite, weight gain or weight loss. So we find people even are losing up to like 5% of their weight. If someone is having increased sleep, you will find someone does not want to wake up, or someone is just waking up too early, finding lack of concentration. Someone can't make lack of decision making. It's so hard for them to make any decision.
Always indecisive.
Yes, feeling heavy. If you have any suicidal thought, ideation, or if you have tried to attempt suicide, definitely you should seek healthcare provider advice. Yes, so after now we see all those symptoms. Now if you have also the headache plus those other symptoms, now that means you are most likely to be having depression. But if it's just only headache, it won't really qualify in criteria for diagnosing the headache.
All right, thank you very much, Doctor. Now, Rita Siovart, I hope your question has been responded. I believe it's clear. And thank you very much for following the discussion. And as you heard from Dr. Pascaline, it's always advisable. I know in this age, we like self-diagnosis. You feel some symptoms and you rush on your Google. You think this is it. Let me just go get some medicine, some OTCs, and I'll be okay. It's not advisable. It's always good to seek professional, comprehensive diagnosis and treatment thereafter. All right, so now, how long does it take to heal? Can someone heal fully from depression, and how long does it take?
Yes, someone
can. Or do you have others who live with it in a lifetime?
Yes, so someone can be treated for depression, and they actually go into remission. But it's also now depend how long did this person have depression before seeking the help. And also, if it is the first episode of depression, usually people get treated well. But then there is some risk of relapse, where now someone gets depression again. So that's also depending on some factors. One being, did this person take their medication? Did they undergo psychotherapy as they should? How many sessions did they do? Did they stop the medication with advice from their psychiatrist? So all those factors will determine if this person will go into relapse or not. So some people will be just treated the first episode, and then they will get okay and go back to their normal life. But then there is those people who now you need to continue giving those medication for a long time. Now, depending on how many episodes they have been having. So if it is like more than 2 episodes, those people are most likely to undergo treatment for a while before they stop. Yes, and also to continue the psychotherapy. So yes and no. So if you have like the first episode, you are most likely to just go into remission. But if you have had many episode of depression, then you are most likely to have medication for long. So also, there is also other factor to consider. Like, do you have a supportive family and friends? So when you have a supportive family and friend, that will help you to battle the depression. Where if for people who are married, definitely they have better support than people who are single, because they have someone to talk to. For people who are employed and those people who are unemployed, it is a different story, because those people who are employed, at least there is a certain level of support they are also getting from there, in comparison to people who are unemployed. Yes, so all those factors will be taken into consideration before stopping the antidepressant. Yes.
Now, for patients whose depression is caused by external factors, say for instance the social media issues or domestic violence, how do you help them during their treatment? Because when they continue to be exposed to the same factors, it risks their treatment. It might even escalate the condition, or even risk a relapse, that is after they have been treated.
Yes, so that's why we don't only give for those people who I said have moderate or severe depression, we don't only give them the antidepressant. You consider the factor of psychotherapy, in which you are going to talk to a psychotherapist about things which may precipitate your condition. So if it is social media, now you learn how to cope from it. Either you stop it, either you have a specific time to be on that social media. If it is, let's say, someone who is repeatedly being, let's say, harassed, now you get a certain coping mechanism and how to help them. Yes, that's why we always also consider psychotherapy. Yes, when dealing with any situation of a depressed person.
And Morgan here is asking, at what point can I be taken to a rehabilitation center if I'm depressed? I think he's asking can the condition make someone to be taken to some sort of an asylum or a rehabilitation facility? So and at what level?
Usually people with severe depression, they will need admission. That's admission to a psychiatrist facility for them to be taking now those medication, so that you make sure those people are taking the medication as they are supposed to be. So yes, you may need to be admitted into a mental facility so that we ensure that you are better. So for those people who have severe depression, like those people who have all those symptoms, people who have had suicidal attempts, so they may need to be admitted for follow-up. So if you have severe depression, yes, but for mild, usually we prefer psychotherapy, yes, and being treated as an outpatient, yes.
Thank you for clarifying that. Now, always prevention is recommended than a cure. How can depression be prevented?
Okay, so depression can be prevented in different ways. One is creating awareness to everyone, creating awareness especially in high school, teaching, if you teach like their teacher, so that they're able to identify depression area. Now on a personal level, how can we prevent depression? One, it's always advised to have a good sleep. That will help, because when you have a good sleep, that helps in balancing the chemicals in the brain that we said when you have imbalance, that's when you can get depression. Eating well, if you are taking a balanced diet with a good amount of fruit and vegetables. For people who are pressured from social media, you can try to either close all those accounts or have limited time spent on that. And also studies have shown that when someone exercises at least 20 minutes, at least 3 days a week, that will help in reduction of your risk of getting depressed. That's because like when you are exercising, it's helped to increase those chemicals that we say in the brain, which in people who are depressed, they may be low, like things like serotonin. So when you exercise, you get that good mood, which will prevent you from getting depression or reduce your risk at least for getting depression. So another thing is to create good relationship around you. So that means talking to your friends, create time to talk to your friend and family. Because when you talk to them, at least you are able to communicate what's going on in your life. You are able at least to be given advice. And also definitely when you are with others, you are at least happier as long as there are people with good relationship with you. Another thing, you just avoid toxic relationship. If now you feel like when you are around some people, they give you negative energy, you are not able to be happy, or you are getting is negative feedback only. So you can avoid those toxic relationship. Yes.
Thank you very much for that. That's quite in-depth. Now, can mental health physicians, are they able to find the right option or treatment modality? Or does one need to try different antidepressants for them to get the right one that works well for them?
Usually in most of the people, we are able to determine which antidepressant will work for them best at the first encounter. But there is those people who will still come. As I have said earlier, usually you will see improvement in those people with depression on antidepressant in the first 2 weeks at least. You will be able to see some improvement. They will come back to you telling you that they are feeling better. But there is some people now who will give a different feedback. So for those people who give different feedback, usually they may be need for increasing either the dose or even adding any other antidepressant. So it varies. But in most of the case, the psychiatrist is able to determine the best antidepressant for you on the first encounter. But sometimes it may be a different case, yes.
Thank you, Dr. Pascaline. Now, someone would be asking, I know I touched on this in my introduction during the first session, but why should we be discussing depression in our times? Because these conversations are ongoing and they always get heated up, especially when it happens, like the most recent case of a young boy, a lawmaker's son who committed suicide. So why should we be discussing the ongoing conversations on mental health and especially depression?
Okay, one of the reasons, actually May is also a mental health awareness month. So that's one of the reasons to discuss it in May. Another reason is that we are having increased cases of depression, especially like silent one, where like people around you are not able to identify that you are depressed. Then you end up, because most of the cases of suicide, usually those people have been depressed for a long time, but no one is able to pick that. So they reach to the point of taking their own life without no one identifying that they are depressed. So now, due to that, that's the reason we should be discussing. And also we are still in a pandemic of COVID, which has affected a lot of people in different ways. It has affected marriage of people. It has affected, most people don't have a job anywhere. And also, you also have like people who have, let's say, businessmen and women who have undergone into loss due to the pandemic and other things which COVID pandemic has brought to us. So that may push people into depression. So that's the reason we should be discussing depression more. Yes.
All right, that's clear. Thank you very much for that. And I'm told our time is up. But as usual, would like to hear your concluding remarks in line with this subject, depression, and especially what you do at Mater Hospital. How special is your treatment? How do you attend to people with mental health conditions?
Okay, so at Mater Hospital, we have very capable psychiatrists. So when you come to us, we usually refer you to a psychiatrist who is able to manage your depression well. And also we have psychotherapists, we have group therapy. and we are usually every time available for you. So that's one of the reasons you should come, and it's also a good environment, especially for people with good and safe environment for people with mental health disorders. So for us, we have like a program in which we are able to help those people who are battling depression, and also always if you feel like you want, let's say there's these people who want to commit suicide, you can always call us for help and we will be there for you. Yes.
So a word to that person who is watching and probably they are having these symptoms, signs and symptoms, and they feel that they cannot confide in anyone who's close to them.
The best way is now to come to the hospital, because now you will meet someone who does not know you, and they will be able to provide care that is suitable for you, and no one will judge you. So the best way is to come to the hospital. And for those people who, because also there's people who can see this person, this friend of mine is depressed, how can I get help for them? Because you can see symptoms. Sometimes people with depression won't agree that they have depression. So you can find a way to talk to them, tell them that depression is a treatable mental health disease in which like more than 80% they actually get well. So that they are able to come to the facility and they are able to get services for them to get better. And also we remember that we usually say health is wealth, but there is no health without mental health. Yes.
Wow, wonderful. Health is wealth. That is the greatest asset any country can have. If you're not healthy, then even the wealth is of no use. Now, at this point, I'd like to thank you, dear viewer, for following this discussion. And it is our hope that you have gleaned what you need to know about depression. In case you have more questions, keep them coming. You know, our number remains 0717424866. You can still inbox our social media accounts on Capuchin TV, that's on Facebook and YouTube, and we'll make sure that you get the help that you need. Now, I'd like to extend my gratitudes to the Dr. Pascaline Isishate from Mater Misericordiae Hospital. Pass our regards to everyone over there, and thank you for the great work that you're doing. All right, I'd like also to thank the team behind who have been helping me with the technical issues. We also apologize that there was some technical hitch-up, but the team responded swiftly. So I'd like to thank my camera person, Felix Juma. My sound person right there was Eric Otieno. On the visual mixing, I had Mabonga Joseph. And on the transmission desk, we have Michael Kibandi. I'd like also to thank the entire team from Mater Hospital and Capuchin TV for coordinating and making sure that this live discourse comes to you in the best way possible. And as we wrap up, I'd like to reiterate that remember, whatever the situation you're passing through, whatever it is that you feel and that is in your mind, there is always a solution next to you. You only need to confide in someone. There are also private platforms online that you can really communicate to a physician on anonymity basis. So do not hesitate to seek help, because later on you'll realize that actually you are not alone, and whatever you're suffering from has a solution. My name is Sasha Elizabeth. Have a great weekend. Goodbye.
Capuchin TV, your Catholic identity.
It is a special event that brought together Mater Hospital Cardiac Program trustees, stakeholders, benefactors and beneficiaries to officially flag off the Mater Heart Run campaign 2022.
The Mater Heart Run 2022 has been officially launched.
Today I'm excited because we have launched the Mater Heart Run 2022. And for us, this is a great win because in the 2020 and 2021, we did not have the Matter Heart Run. And what it means is that if we don't have the Matter Heart Run, we do not have a platform where we invite well-wishers, our partners and our supporters to come together to raise funds, which is put into the Matter Heart Fund.
We are grateful for the continued partnership and support that you have accorded us and ensuring that the needy children with cardiac diseases get new lease of life.
The Heart Run, a Mater Hospital trademark that has been running for the past 25 years, is an annual campaign that raises funds to support needy children with cardiac defects and are otherwise unable to fund the costly medical procedures.
That is what Matter Heart Run is about. It's about touching the lives of children who have no way of ever coming back and saying thank you to us because of what we have done. But for us who have the ability to touch their lives, it gives us that one chance to do that.
Remember, cardiac surgery is very expensive because of the expensive consumables that are used, the specialized doctors that need to take care of the patients and even perform the procedures, even taking care of them in ICU.
Program trustees took the opportunity to outline this year's target and budgets ahead of the actual campaign in June 2022 as they called for support from people of goodwill.
This year, our target is 200 children from both open heart surgery and cardiac catheterization. These procedures will be achieved through your generous support. Already we have about 250 children on the waiting list, and this list continues to grow every day.
We can give our children a new lease of life by repairing the broken hearts. Broken in as those that have holes in their hearts, those that have valves that are damaged and need replacement, those that have vessels that are constricted and they are not taking blood where it's supposed to be taken.
The cardiac program targets children from economically disadvantaged families in line with the values of Sisters of Mercy, which seek to uplift the dignity of the underprivileged in society in the most compassionate way.
The interventions are focused on those who are not able to have financial capacity to deal with their ailments, and that cause of the charism of the Sisters of Mercy, that's a focus.
The campaign has so far benefited over 4,000 cardiac surgery and catheterization beneficiaries through generous donations from local and international donors, coupled with a team of dedicated medical specialists.
A time came when all our resources were depleted, yet we still had a number of cases. It is a leadership that believed that there will be a better tomorrow, and we have not turned a single critical case back.
Andres alikuwa ameturn, the tongue ilikuwa imeturn into purple, makucha zina grow zikiingia ndani. He was pale, angetembea from here to there, ana squat, anainama hawezi fanya anything. He started fainting. Andres alikuwa anaweza like 1 hour, the next hour amefaint. Tulianza kutembea na oxygen, but venye tulifika Mater, for real tulikuwa tume lose hope. Friends walituacha, but Mater ilitupokea, ikatukumbatia, wakatusaidia na surgery. Sahi Andres anaendelea vizuri.
My name is Andres Matano. I am 7 years old. Once I had a heart surgery and I had a problem, and my parents took me to Mater Hospital. They treated me well, and I'm doing well. Thank you.
22-year-old Milka Atieno, one of the Mata Heart Run beneficiaries, had been on and off hospital, grappling with incessant health symptoms. Little did she know that she had multiple cardiac perforations.
I had several holes. Wakaniambia nitahave kwanza clinic. Ile ilifika 2019 March, nika lose hope. Nikasema no clinics anymore. So vile nili lose hope, kapata Mata wakanishikilia. Relatives walienda silent. My mom na my dad, my siblings ndio walini support.
Many other children who had lost hope of living due to heart diseases have found recourse in the Mata Heart Run program.
My name is Misericordiae and I'm 11 years old. I'm going grade 6 and I thank Mata Hospital for making me feel better. And now I am a grown girl and I thank Mata Hospital so much. I thank you to Mata Hospital. I'm graded for 2 and I thank God for everything.
Hii foundation yao imetuhelp sana. Back then sikuwa najua kuna kwanga na foundation kama hii inaweza saidia weak heart, hopeless heart. Ningependa kufanya what my friends were doing, what my classmates were doing, but ilikuwanga challenging. Ilini affect sana kwa sababu when people are moving to another class, me I'm still in the hospital. Most of the times nilikuwa na pass out, more faints, more weakness. But vile nilikuwa treated, nikahave kuendelea na studies zangu.
These are beneficiaries as way back as 2018, 2019 and 2021. These are children who were not able to go to school regularly. They were not able to play with their colleagues, but because of the program, now some of them have gone back to school and they are able to relate well.
Kurudisha shukrani kwa vile Mata walisimama na sisi wakati tulikuwa tumekosa njia kabisa, na wakati tulienda walitusaidia kabisa. Mungu awabariki sana.
The Mata Heart Run campaign is on in full swing, and what stands out the most is the need to improve cardiac disease treatment and management, not just in children but also in adults.
We still hope that we should be able with time and with continuous practice, and we'll be doing most of the cases, that we will be able to come down and do most of the cases. And I'm trusting that that cardiac center, Mata, will be the first one to get it, to probe it.
Over the years, the program has opened its doors to other clients through self-sponsorship and insurance covers, and among these, the NHIF, which have played a very key role.
The day will also be marked in 11 different counties across the country.
If you're in Nairobi, the run will be Nairobi. If you're in Nyeri, there will be a run. If you're in Nakuru, there will be a run. If you're in Mombasa, there will be a run. If you're in Kericho, there will be a run. If you're in Bomet, there will be a run. If you're in Kisumu, there will be a run, and there will be a run in Kakamega and Eldoret. Kindly come and let us all support these children.
I'm aware of the post-COVID-19 economic challenges, but I hope your big hearts will go beyond these challenges to touch the little hearts of our children, who are going to be our future leaders.
For individuals, you get onto the Mata website. We have the Mata Heart Run paybill number, it's there. As a corporate, you can also talk to us. And when the t-shirts come out, buy t-shirts. Even if you're not able to give money, you can buy t-shirts for your groups at your place of work, do it as a CSR, and join us for the run.
One, you touch a child's heart. You touch the society. That's the core. That's where we began.
Touch a child's heart.
It is an annual iconic cardiac program, popularly known as the Matter Heart Run, which had stalled for the past 2 years owing to the adverse effects posed by the COVID-19 pandemic. And as all well-wishers, stakeholders and sponsors gather here today to launch this program, the Matter Heart Run 2022, there is a call to every person who is able to step up and touch a child's heart in a special way as we await for the actual Matter Heart Run on the 11th of June. Asasha Elizabeth, Capuchin TV at the KICC, Nairobi.